Hello everyone, I am Renuka Bhimavarapu and this case study is about INOVA FAIRFAX Hospital's performance, which is done as a part of HAP 725 course from Department of Health Informatics. The data for this study has been taken from data.cms.gov, which is provided by the Centers of Medicare and Medicaid Services. Coming to the limitations in the data, the statistical process control is done at 95% confidence level, which means there is nearly 5% of error rate. Another limitation for this dataset is that data is not available for all the years. Coming to the selective measures, this is a limitation because we will be using only 5 selective measures in this case study, which will make it difficult to conclude the performance of the hospital. The next limitation is that the file name changes over the time. The competitors for INOVA FAIRFAX Hospital are INOVA Loudoun Hospital, INOVA Mount Vernon Hospital, INOVA Alexandria Hospital, Virginia Hospital Center, and Sibley Memorial Hospital. Selection of measures related to acute myocardial infraction includes patient satisfaction survey results, risk standardized payment associated with 30-day AMI episode of care, access days in acute care after hospitalization for AMI, AMI 30-day mortality rate, as well as AMI 30-day readmission rate. Now we will start with INOVA FAIRFAX Hospital versus its competitors. Coming to indicator 1, the graph has been plotted between time period versus score, which is the patient satisfaction, UCL, which is recorded as 88.8 and LCL is recorded as 85.5. The patient satisfaction remained same during 2015 and increased during January of 2016, then remained constant for the rest of the year. The patient satisfaction dropped during April 2017 and later increased during July 2017. Then the rate remained constant. The scores remained between UCL and LCL. Coming to the second indicator for comparison between INOVA FAIRFAX Hospital versus its competitors as risk standardized payment association with 30-day AMI episode of care, we can see that over the years there has been slight growth, but the graph stayed within the lower control limits, and between 2014 to 17 and 15 to 18, we can see the performance has crossed the upper control limits. Coming to the third indicator for comparison, it is the access days in acute care after hospitalization for AMI. As we can see the graph, there is an increase in 2014 and 17, and it increased above the upper control limit, and there was a drastic decrease during 2015 and 18. Now coming to the fourth indicator for comparison, which is AMI 30-day mortality rate. As we can see the graph, it is pretty much unchanged, but there is a slight decrease during 2013 and 2016, and then the performance remained constant. The fifth indicator for comparison is AMI 30-day readmission rate. As we can see the graph, it is pretty much constant, but then there is a slight decrease during the years 2015 and 18, but the graph remained between the UCL and the LCL. Summary of findings based on the chosen performance indicators. INOVA FAIRFAX Hospital performed well over the years in comparison with its competitors. The performance indicators which remained within the control limits were patient satisfaction survey results, access days in acute care after hospitalization for AMI, AMI 30-day mortality rate, as well as AMI 30-day readmission rate. And the performance indicators which remained outside the control limits were risk standardized payment associated with 30-day AMI episode of care. Thank you for watching.